Way to serve all patients, even if there are no more beds left.
Yeah, capacity issues aren't hitting Southwest Florida health systems yet, but there is a way to solve the problem before it starts. It's called Hospital at Home. Wake News Health and Medical reporter Veronica Marshall joins us in the studio. And Veronica, that name sounds simple. How does it work?
It's exactly as it sounds. Certain patients can receive hospital-level care from the comfort of their own homes. But there are some restrictions. Only certain types of patients and conditions qualify for the program. That list includes more than 60 different conditions, though, like congestive heart failure, pneumonia, and COPD. Technology like continuous monitoring makes it possible.
Right now, NCH is fine on capacity, both in the ICUs as well as on the floors.
But if things change after the holidays, NCH's Dr. David Lindner says the hospital has a plan.
Our surge plan initially took us up to well over 1,000 patients, which obviously well exceeds the capacity of Naples Community Hospital. We're a 715-bed facility. If necessary, we would bring the tents back, which we never had to use.
But NCH and hospitals around the country have a new option to try before cases escalate. The Centers for Medicare and Medicaid Services will allow hospitals to treat some patients in their homes.
IV antibiotics, oxygen, close monitoring, lots of lab tests, doctors, nurses. All of our patients wear a little patch on their chest, for example, and that enables us to understand their heart rate, their respiratory rate, their positioning. It enables us to detect falls on a continuous basis.
Dr. David Levine, who studies and participates in hospital at home programs, says the program also improves patient outcomes.
They end up getting readmitted less often, they move a lot more, and they really like the experience of getting care at home.
NCH doesn't have a hospital at home program now, but
if that becomes something that we have to explore, then we will do so.
Florida's Mayo Clinic locations fully utilize the hospital at home care model, and Lee Health tells me right now it has a similar program called House Calls and is researching hospital at home models. Meanwhile, one study found that home hospital care reduced costs by 40%. CMS's recent announcement also makes home hospital care fully reimbursable.